Well, April is Alcohol Awareness Month, and new statistics show this. The number of Americans, adult Americans, that die annually from alcohol use has gone up, get this, 35% over the last 10 years. Forget about how much it's gone up over the last year alone. But you're looking for help. You're ready to take that step. Joining us this morning is Dr. Kapoor. He is a primary care physician with 4C Medical Group. It's part of Optum Care. Important information about how to, first of all, identify the problem. Before we talk about that, Dr. Kapoor, let's talk about just how big this problem is. That's a pretty high number, 35%.
Absolutely. These numbers have been climbing over the past decade, truthfully, and I'm not at all surprised that they are as high as they are, especially within this past year plus with the pandemic. We're talking about everyone has been suffering from this, from kids onwards, all the way up to our senior citizens. And our older adults and adults in general are at risk of increasing the amount of alcohol they are drinking.
So give us an idea, Dr. Kapoor, who is more likely to increase? Let's just forget about the pandemic, but that's bad enough. But give us an idea of what this person might be dealing with or the issues that they're having.
So alcohol is a very common coping mechanism for anyone who is struggling from feelings of fear, loneliness, stress, anxiety, depression, and these have all been heightened by the pandemic. I think
Yes.
as of December, we were looking at the anxiety and depression rates had tripled in the nation. And now it's April, so it's
Yeah.
probably only climbed. These are all populations, anyone who suffers from these things or who has an underlying disorder are at risk of abusing alcohol more.
Okay. What should we be looking for? How can we identify if a loved one might be having a problem?
So the classic symptoms of someone who's drunk is something that you always want to look out for, right? So if they're lethargic, if they're confused, if they're slurring their words. But it gets a little bit more tricky when someone's been abusing alcohol for a much longer period of time. They essentially don't have that necessarily. So you want to look for things like personality changes, or when they are trying to, there's always alcohol involved in the situation. It's not a friendly swing by and chat or virtual chat now with Zoom. It's let me make sure that there's alcohol involved in this situation.
Okay. Yeah. Because this is such a problem, and it has been, as you said, for over 10 years now, well, maybe even longer. If someone doesn't take the necessary steps to find help, what can happen?
So we have a variety of issues that can occur. Alcohol dependency unchecked can elevate a lot of risk factors for folks. It can worsen diabetes. It can worsen risk of having blood pressure issues, heart failure. Liver obviously is the biggest one, cirrhosis and liver failure. And then also things like diabetes in women who are already at risk of developing osteoporosis. It can also worsen that risk.
Wow. Okay. Let's talk about treatment options. What are you guys doing? How can you help those who are ready to take that step?
So good old fashioned AA still works. Alcoholics Anonymous has been around for a very long time. And the reason why it's there is because it has staying power. But we have very good research that shows that folks who have gotten treatment for alcohol abuse and disorder have after a year, they have very good rates of staying sober. If you don't want to go to a group like AA, you can always talk to your primary care provider. There are medications that we can prescribe to assist with that. And then there's also a lot of good resources within the behavioral health realm in terms of therapy as well.
Yeah. All you got to do is take that very first step, reach out to a friend or pick up the phone and call. Your life could depend on it. Well, thank you for giving us some really great information, Dr. Kapoor. We appreciate you for that. Let me give our viewers at home some more information. 4C Medical Group has 15 locations in the Valley. You can visit 4cmedicalgroup.com to find the location nearest you.